Welcome back, everyone. In today's Ask the Doctor, did you know the most frequently reported chronic condition in the U.S. is not back pain, but sinuses?
Wow. It feels like you got a head cold, a stuffy or runny nose, or maybe even a headache. For some, it's temporary. For others, it's just not going to go away. Here to tell us more about it and what you can do is board-certified physician Dr. Ashley Seekand with Nevada Sinus Center. Thank you so much, doctor, for coming in today.
Thank you, Sean.
I hear so many people that have problems with their sinuses, and this is a big issue in America.
Yes, it is. You're quite correct. It's the most common chronic illness in the United States. And chronic sinusitis affects about 35 to 37 million Americans.
That's a lot of people. Okay, let's go back to the biology here and give us a little crash course. What are the sinuses?
So the sinuses are air-filled chambers within the head or face. And they're important in humidifying air, in breathing. They're also important in the way we hear and the speech. So they're, and they lighten the head. So it's important to have healthy sinuses for a sense of well-being and communication.
You have a crosscut, basically, of the nasal cavity. Show us exactly where the sinuses are.
So we have paired sinuses, and we have 8 of them. There's the frontal sinus, which you can see here, the sphenoid sinus at the back. There's a series of ethmoid sinuses here, and then finally the maxillary or cheek sinuses that we all have, and they're paired, so there's 8 paranasal sinuses, they're called. And the most important thing about them is that they're air-filled chambers. They secrete mucus, and then this mucus is drained through small openings. They're called ostia within the sinuses. And it's very important for those to be functioning in order to have healthy sinuses.
And if it's blocked, what happens?
Right. So when they're blocked, they result in disease. Or frequently, we think of acute or chronic sinusitis. That's an inflammation of the sinuses due to either a temporary or sometimes permanent block in the openings of the sinuses.
What are the symptoms and signs? Because there's a lot of people that think, they're not thinking sinusitis, they just think that they're constantly sick.
Yes, and so the symptoms that are produced when the sinus gets blocked, we experience a sense of pressure, discomfort, a sense of congestion. Nasal blockage is a frequent symptom, cough, fatigue, postnasal drainage, discharge.
You just feel miserable. You just don't want to get out of the house. Let's talk about some of the treatment and treatment options out there.
Certainly. So the first line of treatment is a series of medications. First of all, if you have an acute sinus infection, initially what we recommend is just using a decongestant, like over-the-counter, pseudoephedrine. Using this saline or saltwater rinses in the nose can be quite effective. And you can purchase those systems in any of the drugstores. If that doesn't work and the infection seems to extend beyond, say, 10 to 14 days, an antibiotic becomes useful. And then for patients where the infection persists or recurs and becomes more of a protracted problem, say lasting 12 weeks or more, we call that chronic sinusitis, and they require more aggressive medical treatment, such as prolonged course of antibiotics, sometimes steroids.
We're going to take a look at some of the some video or animation on some of the procedures that are out there right now. What's the purpose of the procedure? What exactly are you doing?
So when that type of medical management that we just discussed fails, the next step would be to try to open the obstructed or blocked sinus. And so one of the new technologies that's come on board, as you'll see demonstrated here, is something we call balloon sinuplasty. This is a dilatation of the natural opening of the sinus so that it restores normal function of the sinus. So it avoids the traditional surgery of removing tissue or bone, and rather dilates the opening.
How effective is it? Does it last for a long time?
Well, yeah, the procedure's been out for about 4 years, and we now have data for about 3 years, and the patency rate on the opening of the sinus and it being effective is about 97%. So we have very good data on this.
What are the benefits of this compared to traditional surgeries that are out there?
So with this type of surgery, we avoid some of the tissue removal, more the bleeding, and so there's a shorter recovery time. We typically don't use any packing in the nose after the sinus surgery, and in some cases, because with this technology, we're able to perform this under local anesthesia in the office.
Wow!
And also in selective cases, you also perform a procedure in the office, so that's easy to do as well.
Yes,
for you, definitely.
I've been doing that now for about 2 years, and there's a video clip of this in my office.
What are you doing? Yeah, describe to us what you're doing.
So we're going up into the nose with a telescope.
It's incredible.
And it's attached to a camera. So this is all done with a video. And you can see the video there.
And that's you right there?
It is. And we're passing this little tiny guide wire up into the sinus opening. And
this allows him to breathe again and not having problems.
Well, it helps eliminate those symptoms that we've talked about,
Wow, that's incredible. What happens if you don't treat sinusitis?
You can get complications if the infection is allowed to progress. These are eye complications, sometimes meningitis and other brain complications.
Do you think that you're seeing more cases of this because of the pollutions in the air and the environmental factors?
Oh, yeah, there's been some studies done that have demonstrated that it's definitely an increased problem, and particularly when there's increased pollution in the air. So definitely things that irritate the sinuses, patients who have allergies, or irritating things like cigarette smoke, dust and pollutants in the air will aggravate this problem.
The technology that's out there is it's ridiculous how far we've come in this short amount of time. This is incredible, the fact you can do it right in your office. That's awesome.
Yes, it has really provided a new opportunity for patients, and I hope people take advantage of it.
Awesome.
All right, thank you so much for joining us this morning. We so appreciate it. For more information, call the number on your screen or check out NevadaSinus.com. By the